Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Dr. Ruth Thomson, Chief Medical Officer at Four Seasons, the care you trust. Welcome, Ruth.
Thank you, Millicent. It's a pleasure to be here.
I'm so glad that you are. And as we work with so many patients and families and their caregivers, we spend time in our community and often encounter misinformation about hospice. I wanted to bring up these myths to see if you would help bring clarity for our listeners today.
I would love to help do that.
Thank you so much. Well, let's just dive on in if you're ready.
Okay, let's do it.
Many people believe that hospice is a place. However, we realize that hospice is so much more than a place. Could you share more about this?
Yes, absolutely. So hospice is certainly not a place. Hospice is a specialized model of care that is taken to where the person calls home. Mm-hmm. So that could be a person's personal home. It could be the home of friends or a family member, or it could be like an assisted living or a nursing facility. Many hospices do offer an inpatient unit, and that really is for short-term management of, say, uncontrolled symptoms or other medical needs. But most of the time, that's not where somebody's going to get, most of their hospice care. And so the beautiful thing is that the team brings the care to the person's familiar surroundings.
Oh, that's so important.
It really is. It really is. In thinking about how ingrained this misperception is in the community, hospice that I worked at previously had a large inpatient facility and, cared for about 600 patients a day in hospice. And I would have people ask me, well, how do you fit all of those people in that building? And, I would kind of internally chuckle. I didn't want to embarrass them, but I think that just goes to say that people, really kind of that bricks and mortar seems to resonate with people. And a lot of people do not understand that that is just a small fraction of what hospice care is. And the most beautiful part is caring for people in their personal environment, which is, where it's familiar, where their favorite things, their favorite people, their pets can be. So I think it's really important to know that the care is taken to the person's bedside, where they call home, which is really special.
I love that. I agree, because wherever someone feels most comfortable at that time in their life, we're able to go.
Absolutely.
That's beautiful. And, sometimes makes me think about another myth that we hear oftentimes, that people feel like hospice means that they're giving up.
Yes, that is, that's a tough one, because oftentimes people will hear the word hospice, say maybe their primary care provider brings up hospice, and it can feel very scary. Many times kind of a barrier immediately comes up because people have that feeling. And it could be that the person who's living with the serious or terminal illness feels that way, or it could be their family that feels that maybe, their loved one's going to think that they're giving up on them. And, I think the beautiful thing about hospice, which I would love to get the message out, is it's not at all about giving up. It's really about focusing on what is most important to that person and making the best out of every day, however many days or weeks or months or even years they have left. And it's really honoring that life and just finding as much joy as you can, in a tough situation. I mean, dealing with terminal illness it can be really challenging, but it can also have many blessings.
Well, I think you said that so well, because when we're in hard seasons of our life, we need help. We need hope. We need someone to come alongside of us. And I love that hospice offers that. And, I get how it can be scary. But the beauty is what you said. When you select, okay, it may be time to partner with having hospice services, you have the help and the resources that you so badly need. So that makes me think of another myth oftentimes. And this one is, there are beliefs oftentimes that strong medications like morphine may cause death to come a little faster. Could you share with us the focus in hospice around pain management?
Absolutely. So hospice, we are experts in managing pain and other symptoms. And in order to do that, many people do need strong pain medication. So morphine is one of them, but there are many others. And I think the important thing to recognize about that is that having that expertise in using those medications and managing symptoms should give people peace of mind that they're being used appropriately and being used in a way that that person and their family or caregivers feel comfortable with. So there is no agenda around using pain medication in hospice. It really is based on a person's individual needs and then kind of co-creating that plan of care to manage pain in a way that a person wants. And we can give choices. So some people might say, I would rather live with a little more pain because I don't want to have some of the side effects that can come with strong pain medications. You know, sometimes medications like morphine could make a person a little more sleepy. Some people could be prone to getting a little bit of confusing or kind of that feeling of fuzziness in their head. That doesn't always happen, but that's how we partner with people. You know, it's a choice and it really is very individualized. The morphine issue is a little bit of a soapbox of mine, because I feel like people give morphine way more credit than it deserves. So yes, morphine is an opioid. It is considered a strong pain medication, but it is only as strong as the dose that is being given. So at low doses, which is generally where we would start with somebody who's never taken pain medication, it's no stronger than, say, a pain medication that you might get after you have dental work done. So, most of us have gone to the dentist at some point and needed something for pain. And so morphine really isn't any stronger than other pain medications that are commonly used. It really is based on the dose. And in expert hands of hospice, we make sure that we use the proper doses to try to minimize any side effects and get the most out of managing symptoms.
I really appreciate how you explain that, because it makes me think about another myth, and this one is shared pretty often, where people feel like if they come on to hospice care, they can't have other medical care. Can you share a little bit about how hospice can partner?
Absolutely. I do think that this concern can often be a barrier to people wanting to have hospice services. So it's not an all or none. And I think we can't always predict what's going to happen to in somebody's future. Hospice certainly focuses on comfort, but managing other medical issues is comfort. And so, for instance, if a person develops a urinary tract infection, and that can be a common thing that we'll see in people that are under hospice care, if it's appropriate, if it's part of what that person would want, we would absolutely support doing a test if we need to get the diagnosis and doing proper treatment. Many of our patients at some point may struggle with getting weaker and mobility, and so falls is a common thing that we see. And unfortunately, sometimes falls result in broken bones. So, a hip fracture, a fracture of the arm, and what have you. That's painful.
Yes.
And so, hospice is not going to say, well, we can't care for you. You would have to sign off hospice to get that managed. Absolutely not. Hospice would allow somebody to, if they need to go to the emergency room or they need to get x-rays to find out what the underlying issue is, and then develop a treatment plan. So sometimes if it is a more aggressive plan, they might want to sign off of hospice, and that's certainly a person's option. But many of those things can be managed under hospice. And if the choice is that somebody wants to kind of go in a more aggressive treatment plan kind of direction, and they decide they want to sign off of hospice, which a person has the right to do at any time, they can sign back on at any time too. So again, it's not an all or none. And so, people have a lot of choices. And again, that kind of co-creation of care, of really partnering with the patient and their family members or caregivers to honor their wishes. And I think that's really where it's at, really focusing on a person's goals and their wishes.
It's so important that you share that and that listeners really think about what you just said, because it's so important that people realize that their desires, their needs are prioritized when they're in hospice. And it's not once you're in, you have to stay. But hopefully once you're in, you feel that support and the care that you need. And so you want to, if that's what's appropriate. Which makes me think of another myth that oftentimes come up is people feel like hospice is primarily for those with cancer. We realize hospice is not just for people with cancer. Could you share with us more about that?
Absolutely. So hospice has been around for 40 years or so. And so when the hospice model was originally developed, it was really focused on people that were living with cancer. And that's changed over time. And I think in many good ways, more people are aware of hospice, and then hospice has certainly broadened its scope. So currently, about 30% of patients that are cared for in hospice have a cancer diagnosis. There are many other types of illnesses and disease processes that hospice can support. Common ones are lung disease, so things like COPD and pulmonary fibrosis, heart disease. So heart failure is a common thing that people deal with in our country. And so we can certainly support people that have advanced heart disease and heart failure, and dementias. So we do know that we are seeing an increased prevalence of dementia. I think a lot of that has to do with our just overall aging population in the United States. But we support people that have Alzheimer's disease with dementia, but there are many other types of dementias, and we would care for patients with, any of those types of disease processes. And those are just to name a few. I mean, there really is no limitation to the types of diseases and the types of patients that we care for in hospice.
Hospice is so beneficial, but many people see hospice as only for patients with just a few days to live. Will you share more about the quality of accessing hospice care as soon as one needs it?
Absolutely. I think one of the things that we hear most often from patients and from families and caregivers is that they wish they had called hospice sooner. And so kind of reflecting back on that myth of the fears of hospice, about fears of giving up or fears of medications. There are many reasons why people may be reluctant to access hospice services early. But we have research that has shown that the most benefit from hospice services comes if somebody is on hospice for at least 90 days. So really accessing the services sooner allows somebody to get the most out of the care from the entire interdisciplinary team. And it really provides that focus on quality of life to make sure that the hospice can help people define what's important to them, what their goals are, and help them reach their goals. I think back over the years of caring for people, some of the incredible things I have seen, such as planning a wedding that was going to be, say, months or a year away, but time was shorter. And so it really gives the team the opportunity to work with that individual and their family and do some amazing things. So that's hard to do if you're only looking at a few days. So, whereas some people do come to hospice when they are at very end of life, and oftentimes that can be when there's been an acute event, an acute medical event. But if people are living with serious illness, I would definitely suggest that they consider accessing hospice as soon as possible, as soon as they're determined to be eligible, so that they can really get the most out of the care.
Thank you for sharing that. It makes me think about the traditional thought around hospice being for those who are elderly. Oftentimes we see patients of all ages. Could you talk a little bit about that?
We do. So, hospice is primarily a Medicare benefit, although hospice is also covered by regular insurance, it's covered by Medicaid. But because it is very focused in general on Medicare, the vast majority of people are age 65 or older, but that is not all that hospice does. I mean, we certainly take care of people who are much younger than that, young adults, middle age, with a variety of illnesses. And hospice also supports pediatrics, which is just so incredible. I mean, it's hard to think about that, but imagine when a child is living with a complex illness, how much that impacts not only that child, but their family. Yes. And so the beautiful thing is the hospice interdisciplinary model can provide that wraparound support to help them live as well as possible, to cope, and then, of course, to deal with any grief issues.
I think it's so important that individuals realize that hospice is available for those who have a serious illness. And it's not restricted just to an age. Oftentimes, as you said, we do see it being those who are in an older population, but we are starting to see even more from the pediatric population. That gets back to the connection of why equality is so important, and really listening to what's most important to those that we're providing care for, as well as their loved ones. So hopefully all of these myths that we've talked about with some education has given some peace and perhaps some direction for families, which makes me think about, when is the right time to call hospice? How can you access this quality care?
That's a great question. So if you're or somebody that you care about is living with a serious illness, certainly if one of their healthcare providers has shared that the illness is getting worse and maybe reaching kind of more that end of life phase, that is the time to call hospice. And that doesn't mean that somebody has to be at the very, very end of their life, meaning that they are no longer able to do what they want to do. A person can still be quite functional. There's no requirement in hospice that the person be bound to their home or not able to get out of bed. I mean, we certainly have people who, can go out and enjoy dinner with their family, or, if they still enjoy going to the grocery store, they can do that. And so I think waiting until, things get to the point where they can't do those things is not necessary. So I think if there's any question about, an illness getting worse, a person struggling just with their ability to function or struggling with symptoms, and, there's a conversation with their primary care provider, other healthcare professional, that's the time to reach out. Then working with the hospice to try to determine, is that the right time? And if it's not, then there are other options like palliative care. So there's a continuum of care to support people even further upstream if needed.
I'm so glad that we've had time together today to talk about hospice and how it can add such quality to one's life and to their family, to their loved ones. So for our listeners, if you would like to learn more about hospice care, please visit us at fourseasonscare.org. Thank you.
Thank you, Millicent.
The Quality of Life podcast is produced by Four Seasons, the Care You Trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.